Hi everyone, I'm trying a new camera angle here because I don't want you to see my weird shelf, and I think the lighting is better. That's a weird start, but I am feeling kind of awkward because this is a really personal topic, and I have more personal topics, but I think this is a really important topic to those going through mental health struggles. And I really, really wanted to make this video because I know people who are not suicidal or don't need to go to like an ER or emergency room, but it's hard to find therapy, or therapy's not enough, or um, basically, if you need more help than getting locked in a psychiatric facility, or um, if you need less help than that, but you need more help than like once an hour, or once an hour a week, or once an hour every other week. Um, so I'm gonna be talking about outpatient, like psychiatric outpatient. I think it's called like behavioral health services. Um, it's usually called intensive outpatient program or partial hospitalization program. And they they make it I they change it to IOP and PHP. So IOP is the background is distracting me. IOP is what you do after PHP. Um, Basically, you go to a behavioral health services portion of a hospital and you get placed in their program. So let's just back up to like let's back up to why I'm even making this video. So I'm making this video because I myself have been through a lot of mental health struggles, mainly depression, and it's been pretty severe at some points. And in college, I was pretty depressed because I was I was in engineering, and it was like a difficult environment, and I've just been struggling with this since high school. So that was the first time that I actually went to outpatient. I signed up for it. So the story behind that is I was just so depressed. I didn't go to my classes, my college classes, and I reached out to the disabilities office because one of my classmates, not classmates, friend's roommate, she had told me about getting accommodations if you have a disability, um, even if it's like mental disability, like ADHD, anxiety, depression, dyslexia. So I just reached out. They said it would even out the playing field. I was like, feels kind of like cheating, but whatever. I'll just take advantage of the system, right, if I can. I actually really needed it. And I was working with them to try to kind of get my coursework in and my homework and get more like time for my tests and stuff. I didn't end up doing that because it was really awkward. But they did mention I had this really understanding person who helped me who who helped me like understand what I would need and what kind of accommodations that I would need. And I was telling her, like I didn't even attend class. I couldn't attend. I'm so like I don't understand what's happening with me. I'm so depressed. I need extra help. I don't know what to do. Like, I'm not like actively suicidal, but I would like to sleep and never wake up again. And so she was really understanding. She said, like, I don't know if there's anything I could do for you academically, but I do know some people who have been who have signed up for a outpatient program, which is more like intensive therapy. You go, because I was already going to therapy and I was going like twice a week, once a week. She's like, if you need more assistance, I really think this would help you. Yeah. So I called. It was awkward. I got into a really good outpatient program near my school in LA, near UCLA. And here's some things that I think would be helpful to know. First of all, it's very helpful. They teach you a lot of stuff. So let's get into the technical details. Oh, by the way, I have a note here. So I went summer of 2017, my first time, for major depression. I've been to 3 different outpatients. One in 2017, that's my first one in 2020, before pre-COVID, and one in 2023, which is last year. And the differences between, they'll explain this to you, but just so you know ahead of time, IOP is going to be what happens after PHP. PHP is going to be way more intensive. It's kind of like a partial hospitalization. Basically, what you're doing is attending group therapy every day for a few weeks. So I put down, the content is basically the same, you just have less. Partial hospitalization, you're going to do up to 5 days a week. And usually you do it for like at least a few weeks, like at least 1 to 2, if not more, like 6 or 8. You can do less though, depending on how fast you are. Also, I'm going to talk about good ones. So I'm just making a note because I want to talk about how to find good ones. And then usually they have like 4 to 8 if you're doing partial hospitalization, but if you're doing, it's like a transition. So you do partial PHP first and then IOP next. So you can choose, but they'll place you in partial right after. And typically what happens is you either sign up for it and you've been hospitalized before and you transition directly to partial, or you just ask for PHP and then you start off in partial and then go to intensive outpatient, IOP. So you start out really heavily doing like 4 to 8 hours a day, almost 5 days a week, for a few weeks, and then you transition. So when you transition, you go like 2 to 3 days a week, 2 to 3 hours at once. And for this one, you're allowed to stay in it longer. I know some programs don't allow you to stay. They have like a set timeline for the maximum amounts, like a general recommendation. But that's one of the things I want to mention, that a good one usually will have a time limit just because they want people to be making progress and be serious about it. Not like a huge time limit. I think like 3 months is like a decent one, just like having like a limit, especially if many people want to go in that program. So I think what you should expect from an outpatient or like any of these programs is, first you need to call and take an intake. If you're already hospitalized, they might already just like skip that. They're gonna ask for your medical history, like hospitalizations, like depression, like your symptoms. They might make you take like a questionnaire, like a there's like this depression questionnaire and an anxiety questionnaire that they often like to give you. You're gonna have to make a schedule, so match the times that they have. You have to make time for like 3 days a week. I made time for it just because I needed it. Also, it's usually in person and it's groups. It can range anywhere from like 3 people to like 10 people. They'll also pair you up with a psychiatrist and a individual therapist. and a social worker who coordinates everything. So typically someone will coordinate like your care, like when you're your psychiatrist appointment, when's your therapy appointments, what days are you going, like if you're absent, who you get to contact, if you have any questions, insurance questions, you can also ask them. There's usually one point of contact. It might also correlate with who your therapist is. Usually you get also individual therapy. Also, usually it's covered by insurance, especially if they see that you need it. But don't quote me on that. What you're going to be going over is a bunch of content. So there's CBT, DBT, meditation, interpersonal skills. DBT includes the stress tolerance, emotional regulation, values, goal setting. They have what's it called? Career help too. They have art activities. Thinking about what I did. The most recent one, they have like addiction. Oh, they usually have addiction or like drugs. Usually they want you to be drug free, but they'll help you. They have sometimes eating disorders, drug disorders, health disorders. They have women's group. They have a bunch of stuff. Honestly, it's very helpful if you need that extra support. Yeah. So if you guys have any other questions about my experience for outpatient, or you're thinking about outpatient and don't know whether to do it, or you just have questions in general, you can always ask me. I will be searching the comments, and it's not as scary as you think. It's very normal. You basically, I feel like it's taking classes because I was taking notes and stuff. You basically go in, learn what you need to do about yourself and your emotions and your illness, or your condition. You get to talk to people. I made some friends. We didn't keep in contact because our lives are busy, but you get to share your experiences. And I definitely want to do one on DBT, like a video, but it's different when you go in person. It's a lot of coordination and it's a big commitment, but do what you can to help your mental health, and to help yourself, right? Just like prepare for the future. Okay, so I hope this was helpful. I'm not sure if there's any other people who have been to outpatient and think like really hated it. I'm not sure if I've been to several, so maybe I've just been to so many. There are definitely some that were better than others, but I really hope this helps. If I can find at least one person that this helps, it was worth it. And even if it doesn't, you know what? It's out there.